He's back. It's Tuesday night and he is back. Can't keep a good man down. I have been away for some weeks because of Easter and what have you, and I am now. Oh, what? I just remembered. Instagram won't let me go live. Oh no, I'll do it. What should I do? Oh no. Let's do it. Oh yeah, I just remembered that. Right. Right, Instagram won't let me go live. I must have done something to upset someone at some point. I'm just going to do a post. Right, yeah, Instagram won't let me. God knows why. I don't know why. Okay, join me on. Actually, I should have said join me on Facebook. That'll get them in. Your story. Post. Reel. Syncing clips to audio. Oh. You'd think I'd know how to do this by now, wouldn't you? I don't know what is going on here. Discard. Create. Post. How do you use your camera? Add. Okay. So this what have I done? I just posted the same thing again. Clara. Okay, I'm going to leave that. I'm going to move on and I'm going to just focus on this because that's beyond me at this present time. So here we go. Got some questions. If you've got any questions yourself, please feel free to ask me. I'm sorry I've been away for a few weeks. So here we go. I had implants some years ago. My right breast is sometimes rock solid. It's never felt as soft as my left side. This does not cause pain, just sometimes discomfort. Could this be a problem? Well, no, it's only a problem if you feel that it's a problem, because what that sounds like is capsular contracture, which is something that happens to breast implants over time. And it's kind of normal, really. It's your body's reaction to the implants, in that the body walls it off in scar tissue. And over the years, that scar tissue contracts and hardens and makes them feel hard, feel rock solid, as you describe. So in time, that can progress to become uncomfortable, but it sounds like it's occasional discomfort here. And it in itself is not a problem. It's a natural reaction. It's simply scar tissue, and nothing needs to be done. The only reason that something would be done is if you want something done. So if you are concerned and you want reassurance, then fine, then go and see a doctor and, you know, check everything's all right and what have you. But if you and that's it, and it's just and you know, capsular contracture is nothing to worry about. If, however, you don't like it or you want to have something done about it, something can be done about it, which would involve what's called a capsulectomy, which is removing the implant with that surrounding capsule and putting a fresh implant in. Quite a big operation, that, and another capsule will come when the second implant goes in. So you don't really want to have it, you know, until you need it, because the longer you leave these implants, the better. But it's a normal part of having breast implants in, and nothing particularly to worry about. Do you use Polytech brand prostheses? What was the largest prosthesis inserted by yourself, and up to what maximum size are commercially available prostheses produced? Or instantly worry with this question, because I don't really do large implants, and obviously this person's looking for large implants, then I'm not the right person. To be honest, I'm not really. What are these questions? Yeah, these questions are all kind of about implants and tummy tucks and stuff. I'm not really doing that now so much. So anyway, so yes, I did use a lot of Polytech prostheses, and I don't know what the largest is. I go on base width, probably about 600 cc's. What is the maximum size commercially available? I don't know. Probably around 600 cc's, 620, off the top of my head. It depends on the width, but you can also get custom-made prostheses if you want to be extra large. And I know there is a niche for that patients who want very large breast implants. Not really a niche that I have ever really filled, and not something that I've really focused on. So probably not the person to be speaking to if you want extremely large implants. There's other people out there who will probably do a better job of it than I would. What we got? Can you have abdominoplasty if you previously open umbilical incisional hernia repair with mesh that was due to complication from prior surgery? If you've had an open umbilical incisional hernia repair with mesh. I'm sure we had a question like this. I'm not doing the wrong questions on my 16th of April. Yeah, I'm sure we had a question like this. So the answer to that question is that yes, you can do an abdominoplasty if you've got a mesh from an umbilical hernia repair. The thing that would concern me is the incision. So we did have this question because I remember someone sent me photos afterwards. Is the incision from the umbilical hernia repair would be of concern, because if that's going above the belly button, then that would implicate the ability to be able to do a tummy tuck if you've got scarring going above the belly button in the upper part of your abdomen. That would be a potential complication and a potential problem doing a tummy tuck. So actually the scarring of the hernia repair would be a concern to me. The actual mesh there would not particularly be a concern, only that you're opening the abdomen again and there's risk of infection, and mesh getting infected is really bad news. So that would be a risk, but you know, the doing of the tummy tuck would be fine. It might affect the ability to repair the recti muscles, because it might splint them a bit if the mesh is a sort of big block of scar tissue. So there's, you know, a couple of issues that you might have to consider, but nothing that would be I mean that you will now able to have surgery, although you might have to accept perhaps some extra risks and perhaps some limitation in what we could do in terms of bringing those muscles together. Do we offer treatment for lipedema? No, we don't do lipedema. Lipedema is quite a specialist area, usually the lower limbs. And Dancy used to do it here in Birmingham, but she's now moved away. I'm not sure. I think Mark Soldin does it. I think. I don't know who does lipedema, but it is a kind of subspecialty, really. That not everyone does it in terms of plastic surgeons. There's only certain plastic surgeons who would kind of make a name for themselves in that area, and I'm not one of them. So so yeah, lipedema I think Mark Solden would be my advice at the moment, because I know that Anne's not around the UK anymore. So yeah, sorry about that. I still want to have the surgery, but the lip pulling and asymmetry is a worry. What the heck? Mikhail Vorvarchis in London said it could be done in 2 stages to avoid this. Is this something Mr. Staiano could do? Right. Okay. I remember this. Yeah. Thought I walked in on a conversation there. Right. Yes. This is a patient who's got a lesion on the lip. It's quite a large nevus on the lip that I've said it will pull the lip across, and so someone else is saying do it in 2 stages. It is difficult. I think a lot of plastic surgery you do get different opinions, and that doesn't necessarily mean that one of them's wrong if they're saying different things. It's just about our experience and our views on things. And I do find it a bit difficult when someone kind of says, oh, I've seen this other surgeon and they've said this thing. I'm fine to talk about it, but which is fine, and I encourage that. I encourage you to see other surgeons and certainly come back at me if they say something different to what I've said. That's absolutely fine. What is a bit different is when you say, I'd like it done like the way they said it, because I'm like, well, then have them do it, because I gave you my best advice, and I'm not sometimes I'm looking for help, but often I'm not looking for help and another opinion. If someone's got another opinion, that's fine, and that's based on their experience and their expertise. And if you think that sounds better, absolutely fine. I will not have any problem with you having that done, but I'm not going to kind of do it that way, because I've already said this is the way that I think is the best way to do it. I've already said what I think the best way to do it is. So yeah, this is a large nevus, could be done in 2 stages. Of course it could be done in 2 stages, and the problem with that is it's 2 operations. Each operation will be at least 4 months apart, and there is enough laxity in order to get that lip closed in 1 stage. And so I don't see the need of doing it in 2 stages. That piece of tissue has to go one way or the other. And the only reason to do it in 2 stages would be if there wasn't enough laxity to get it closed in 1 stage, in which case, yes, you could do it in 2 stages. But I wouldn't necessarily think it would be worth, both financially, because you'd have to pay twice, obviously, but also recovery wise, for several months you would have a scar and kind of half your nevus. So I don't see a benefit in it, because, as I say, I think it'd be possible to get it all across. And I think the lip pulling and the asymmetry would happen even with the 2 stages. If I thought it wouldn't happen with the 2 stages, then by all means I would do it. But I think it would happen whatever, because that piece of tissue has to go one way or the other. And that is definite, whether it's 1 stage or 10 stages or 2 stages. So yeah, I would say if you think that sounds better, I would go with Mikhail Vorvarchis. I don't know who that is, but I would go with Mikhail. And I don't think it's unreasonable. As I say, I think it's, if that's what they've said, I think that's perfectly fine. And I would, it'd be interesting how you get on. And I've got to be honest, I'm not sure if this is working. I've got to be honest, I might be talking to myself. Either that or there's no one out there. But anyway, first one back just shows you when you haven't been doing it for a while. Instagram definitely didn't work. I think Facebook and YouTube did work, but I might be wrong. Time will tell. Anyway, if it has worked, by all means put a comment in and make me feel like there's someone out there. And if it hasn't worked, well, that's 20 minutes of my life I'm not going to get back. So I will be back next week and do it all again. If you've got any questions, please do let me know. I hope nothing's happened in the world that I've met. Oh, I can see some people outside. Okay, there hasn't been some kind of desperate thing happening and everyone's run away. Anyway, okay, good. So stop the stream and I'll see you next week, I think. pretty sure. God knows, to be honest with you. But yeah,